Dr. Patrice Harris is the AMA's president-elect and chair of the AMA Opioid Task Force. She is an advocate, leading the effort to reverse the nation's opioid epidemic. Throughout her entire career, Dr. Harris has been a leader in organized medicine to ensure the voice of physician and patient is represented in healthcare transformation. A key theme for Dr. Patrice Harris is the involvement of local communities in finding solutions for the nationwide opioid epidemic.
I always say that the solutions that may work here in Atlanta, Georgia, may not work best for folks in my home state of West Virginia. So it's important that there is a local lens to any collaboration or comprehensive solutions to address this issue.
And the AMA has a comprehensive plan based on 6 specific recommendations from its opioid task force.
The first is for physicians to use their PDMPs.
A prescription drug monitoring program is an electronic database that tracks controlled substance prescriptions, providing helpful information about a patient's prescription history.
When PDMPs have real-time, actionable data, physicians can use them as a tool, again, along with our patients, to make treatment decisions.
Enhanced education also helps remove stigma, the myth that a substance use disorder is somehow a character flaw.
But the evidence shows us that an opioid use disorder, any substance use disorder, is a brain disorder. It's an illness. It's a medical illness. It's a chronic illness. We don't have a cure, but that's not unlike diabetes or high blood pressure.
Are we seeing successes, and what successes are we seeing in the prescribing of naloxone?
Increasing access to naloxone is critical. If we want to decrease the number of people who die from an opioid overdose, naloxone is the overdose reversal drug medication. We encourage physicians to consider co-prescribing naloxone to their patients that they think are at risk or at high risk for an opioid overdose.
And while the availability to naloxone is increasing, overall access to treatment is still an issue. Only about 12.2% of adults who need treatment for a substance use disorder receive any type of specialty treatment.
We know that too many people are dying preventable deaths when we know how to help them. And one of the ways to help them, of course, is increasing access to treatment for those who have an opioid use disorder.
And they do that by removing barriers to treatment, the stigma, increasing resources in local communities, improving safe storage of prescriptions, and the disposal of all unwanted and unused medications.
But there has been progress. The number of prescriptions written have decreased around 22% over the last 5 years.
It's part of the effort to reduce elevated overdose rates.
The other key point to make at this point is the epidemic has evolved. Most of the overdoses today are related to fentanyl and heroin. And so we have to make sure that there are policies in place, plans in place to address that.
Dr. Harris is also passionate about increasing access to alternatives to opioids for treatment of pain.
First of all, the patient has to have access to those alternatives. If the alternative is physical therapy, they may have to have additional copays, which means they might not be able to afford it. They have to have transportation to get to the additional, perhaps 3 times a week physical therapy visits. So I always make that a point that policy is a first step, but we need to think through implementation.
And implementation of policies and ideas is where Dr. Harris focuses her message. There needs to be a public health approach to this, right?
Absolutely. At the core of this is a public health approach. We have to make sure that we think through the barriers on the next level, such as transportation, addressing those social determinants of health, to make sure that policy is not just policy on paper, but it's policy in action.
The opioid epidemic is a complicated issue with much more work remaining to be done, but the AMA is committed to empowering physicians and communities to end this epidemic. In Atlanta, Georgia, I'm Craig Boswell.